Hello. So this is a procedure we're doing a couple of weeks before the conference, and very complicated, difficult procedure. A 90-year-old patient who has clear angina, uh, not so much at exertion. He has it mostly at rest, actually. Was sent to me because of his complex anatomy and really kind of very challenging anatomy. LV function is good. Blood pressure is good. He's about 110. I say that only because I think a little bit about support for this case, and we can discuss it. But I want you to look at the anatomy. And I'm going to change this to fluoro. Here we go. Okay, so left main is sort of okay, at least proximally. But as you can see, there's a big aneurysm in the LAD, and I think his culprit lesion is that LAD, which is hanging by a thread after the aneurysm. And these aneurysms can be very difficult to deal with respect to wiring. So I suspect I'm going to have a lot of trouble with that. This is a really good view, a spider view. You can see the circumflex has some lesions there, some blockages. The left main doesn't look great. I can IVUS that. I might need to treat that. But for now, I'm going to try to get this LAD open. Here's another picture of it. I'm worried about the calcium, obviously. We could rotablate if we need to. I'm not so worried. I get asked all the time, what about thrombus in the aneurysm? That is not usually my problem. My problem is wiring it. And I've had to, last time I did one of these, I did a backflip, curved around the aneurysm. That got me through. Did that with a polymer wire. Notice that the circumflex has some lesions, and notice that the right coronary, of course, is occluded. So this is a high-risk anatomy case that's got me reasonably worried. I think this will be kind of my working view once I get the wire to the aneurysm. And getting through that aneurysm should be very interesting. So let's see what happens. Let's see. So give me a little test here. I'm in the AP cranial view now. Let me do something a little different. I'm going to just stop that here. All right, so we're in a spider view just to get the wire into the aneurysm. Okay, Ricardo, give me a little test here. Let's see if I can get this in there. Okay. All right, we're on our way at least. Okay, so test again. So we're in the aneurysm. That's good. And I'm going to bring my microcatheter down. And then we'll see if we can somehow find this LAD. Okay, test here. Maybe it'll be easy. I doubt it, though. My experience with this is it's not usually easy. Okay, so I'm going to look and see if there's a better view. See the test here again? It'll give me a sense of where this is coming. The other thing, what I did once was go backwards like this and managed to get the thing to go make a loop and get right in there, which not with this kind of wire, though. Did it with a polymer wire. So I'll get to that. Let me just see if I can get straight in it first, using some other view. This is just a steep caudal little REO, and you can see where that LAD comes off. And I'm going to give this a try in this view. Test there. Okay, so the guide is now out because I was pushing too hard with the wire. All right, test there. Okay. Test again. So let's put this down here. And let's see, test again. So, maybe is it possible I can just go along this? Oh, look at that. Mm-hmm. Made it kind of easy. I shouldn't say that yet. Test there. Am I in it? I think I am. You're in there. Wow, that's awesome. Okay, there it goes. There it goes. Okay, let me just get the other view. Okay, this is all with the BMW. I love it. Little test there. I think it's going to go. Maybe I'll get a polymer wire. So I'll put you guys have that, a whisper I think I asked for? Now, I don't know if this is going to go through without a guidezilla or a guide liner. It may not. Should have thought of that earlier, shouldn't I have? Because the guiding catheter is kind of lousy here. Okay, if it doesn't go through, what I'll do is do a wire exchange and get a guide liner behind this thing. So I'm twirling this Turnpike X P, and it's not really going down. All right, let's see if I can get the wire down a little further, because that would give me some more support. Now, it's not a septal there. Test there, if you can. Yeah, so the septal's up here. So if I can get this down the LAD, but if I can't, what I would do is take that septal, but I think I'll be all right. Maybe let's see, test there. Just want to get some purchase with this wire, so yeah. So I need a guide liner, a Godzilla in this thing. So I'm gonna stop here, and I'll be, and then what I'm gonna do is just lengthen the wire. I don't want to take any chances, and I'll get a Godzilla in here, and that'll make it better. So I'm doing this. Let me get a torque on this. I'm doing this radially, and that's why I need this Godzilla pretty badly. I mean, it's really, I don't have a lot of support, and it's pretty calcified. So I'm going to try to get the wire down as far as I can. I made it a different wire. My guide is kind of terrible, isn't it? Yeah. Oh, boy. Struggle. Okay, test there. See if I can get that wire to go down a little further. And that's LAD. That's got to be a septal, right? I assume. And that's the LAD. So that's actually great. So now I've got a stiff wire where I need to have a stiff wire. And hopefully I'll get this. This is a Turnpike LP, but we've got now also the Asahi product, the Corsair, which might be helpful. The Corsair XS, which we're looking for. We just got it in just like last week. If this doesn't go, we're starting to think about rotablator, right? And it's not going. All right, so next thing I'm going to do is try an ultra short balloon. I'd love to get my guide in here. Okay. And an ultra short balloon, like even, because right with the 1.5, but we even have the new 1.0s from CSI that I have been found very helpful. Because I can't get this to go. I'm spinning and spinning and spinning. And notice I have no guide support at all, which is really unfortunate, isn't it? I got to be a little careful with this guide liner or this Godzilla as I take it all the way down there. Still not giving me, it's better support, but it's not what I need. So let's see if I can dilate this a little bit. It's very calcified. All right, so I'm going to take this, why don't we blow out the Turnpike. And we're just going to blow it out, and then we'll try a balloon. So this is a 1.5 by 6 balloon. And we'll just see if we can get in there. And if this doesn't work, we'll try a 20. I know some people like that better. They think the marker is in a better position. As you can see, it's not really being very helpful. Boy, I just need better support. It's just as simple as that. We're going to be rotablating this pretty soon. All right. The 20, that didn't work. Now I'm trying the Sapphire from CSI. It's also, my error here is not having a 7 French system. I'm in from the wrist with a 6 French, and so the guide liner is not going to be able to help me rotablate. That's the only problem. I'll take it all the way down there, see if that, it just doesn't give me any support. The wire's coming back, so I'm going to have to try to do a rotablator exchange, just exchange for a rotor wire here, which is not going to be easy. And I'm wondering if I should start again with a 7 French system. Let's take this up here at 10. 12. You're not going to be able to see that balloon go up. But we'll see. I don't even, hopefully it's engaging in the lesion. I'm not sure if it is or not. I doubt it is. Yeah. All right, come on down. All right, I'm going to have to think about how to handle this, because I can try to get a rotablator down without a guide liner and rotablate, but that's going to be tricky. I got myself in a better position here, and I've been able to get the Turnpike I got the guide in just some better supportive position. And now I'm getting the turnpike LP down, which is really exciting to me. We're setting up for road ablation, which most of you think I should have done from the start, I know. But I find I can often get away without it. And now that I got the turnpike in, I might still be able to get away without it. We'll see. Now that we've opened up all the equipment. All right, so the next thing I want is a wiggle wire, please. Just fighting my way. I'm twirling this thing 10 times around in one direction, then 10 times in the other direction. I'll work my way down. Good. And now I'm going to get a wiggle wire and put it in there. So we got the wiggle wire down. This should be pretty easy to pull out the way I probably already showed you guys. You just sort of twist it a little bit. You don't even have to extend it. See, I'm just not even extending it. I'm pulling out. All right. So now we're going to try ballooning before we get the rotablator. Try ballooning again, and some of you may think I'm crazy to even try this, but I'm going to try it. I got a turnpike down there, so maybe I should. This is a 2.0 balloon. See what happens. I think it's going. Definitely going further, right? So I've got the Guidezilla in there. My guide is in a better position. Yeah. All right, let's take this up here and go to 10. 14. I'm really past it. See, it's opening. Down. Okay, give me a little test here to see what's going on. Good, it's a good location, right? Give me a 2.5. I take this up to 6. So stick up to 16, and give me a 2.5 NC, please. 12. Go to 16. I don't know if that's fully expanding there, isn't it? Yeah, I think it is actually. Come on down. It's probably a bubble. Yeah. Go to 16 again. And down. So you finally got me our Corsair XS, the new one, right? Except that I already got this. I got the LP through. I don't know if they're any different. Let's give a test here. I'm being very careful with the Guidezilla. Inject. All right. So I think this is looking good. Do I need any more stents distally on this? No. Let's just take care of the proximal problem first. The other thing I didn't do was dilate here. Let me just do this. Yeah, take it up there, 16. And down. And you know what? I'm going to make a change. Could you give me a 2.5 by 30 NC? Yep. A 30 millimeter NC. Test here. Because I want to see how long a stent I need. So we'll put this about to here. See that? Inject. Good. So that's going to be about the right length distally. And now let's look in the caudal view. You can see that this 30 millimeters may be about right, or maybe a 32-ish. Inject. So we're going to push it in a little bit here. And then I'm going to look at the left main. I'm going to just take this in a little bit. I take it up there, 10, 14, 18. Now I want to just make a note that looks like it's expanding, right? Let's be sure, though, in this view here. Yeah, I think so. You know, we can argue about rotablator and go to 20. Maybe there's a little pinch in it. Nah, it's not. It's fine. Go to 24 and down. So, I don't know. I'd love to see a good randomized data from this, and which hopefully we're going to see with the CSI device to tell me if I really need to go through atherectomy in this kind of a case. But so far it looks pretty good, right? What is that lesion downstream? Is that something that needs a stent? Kind of looks that way, doesn't it? I tell you what we'll do. Let's do it. Well, I got to take my guideliner out, or Guidezilla out to do IVUS, so I'm not going to do IVUS yet. Let's get the lesion stented, and then we'll see about that other lesion. I'm probably going to just put a stent in it though. This is a Resolute stent. It's a 3.0. We'll see if it's going to even cross. So maybe this is where my rotablator atherectomy friends are going to say, why don't you just atherectomize that thing? It'll be easier. Stop struggling, Paul. I don't know. I just want to minimize chances of complications. And this is going. All right. So he's 90 years old. I think this is... All right, test there a sec. Let's see if we have the distal. So we're just about right distally, right? So now I'll go proximally and see what I end up with. Mean injection? Hard injection. All right. So this looks pretty good, actually. Actually, it looks real good. Let me see if I can zoom that maybe. Actually, if any, I think it's maybe perfect. Could be maybe come back a tiniest bit, right? Just a tiny bit. Test there a sec. Okay, let's see about this one. You ready?
Ready.
Hard shot. So I can, all right, let's just take that up there, 10. It's kind of a weak shot. 14, 16, 18. Down. So I got full balloon expansion despite all that calcification. All right, so let's see what it looks like. Hard shot. Hard. Really hard. Come on. Make me look good. Okay, I know it's hard with all the stuff in here, but I think that looks good proximally. I'll get the balloon out and make life easier. I didn't want to take the balloon out until I was sure there was no perforation. That's why I did that. In this view, ready? Inject. It's pretty good. And actually, the second lesion doesn't look so bad anymore.
Right.
All right, so look. Let's do an IVUS now of the left main. This is the IVUS distal to the stent. This area here, where's that? That looks like, you ready to inject? I need to know where that is. That's my area where I thought might need another stent. Inject hard. Yep, that sure is. So I'm going to go forward to see what diameter is. 1, 2, 3. And then we're going to see our stent soon. It's a nice big vessel. There's our stent, which looks pretty good. I mean, it really does. Now, I'm very interested in the aneurysm, which we'll probably see shortly. And I think that was it. Was that it there? Nope. I don't think that was it. Yeah. There it is. You can see that it's sort of floating, which is fine. And then we should see a vessel again, which we do. And I think it looks pretty good. And then the question is, what's the left main like? There's my left main. Guys, it looks really good. I don't think we have to do the left main into the LAD. I do think I have to put another stent distal, which is what I suspected. I think, so this is, we're back. I was able to get the stent through the previously placed stents pretty easily. I think that's where I want it. You ready to hook up here, guys, and go up? A little test there to make sure everything's good. Okay, let's take it up there. Go to 10, 12, 14. It's a 3.0 stent based on the IVUS. Make me look good. All right, I love it. All right, so let me just, I think we're done with the LAD. And we might break this by trying to make these tapes pretty short. So I'm probably going to work on the circumflex now. Hard shot. Yeah, that's pretty easy. He's also got an occluded branch there. I'm going to play with that a little bit, but I think for the purposes of this 20-minute tape, I think we've done enough. I'll let you know what we end up doing with the circumflex. The right coronary can be fixed as well. He's 90 years old, though. I don't know if that's really needed. Really good case. That left main you see here, angiographically, really looks okay by IVUS. I'll measure it. And if I have to put a stent in, it's not a big deal. I thought this was LAD, though, was really challenging. All right, thank you.